what do we need to know? Like, how do monoclonal antibodies work? What's the data to support their impact? Why don't we start there?
Yeah, absolutely. So, I agree with you. This is something that's been weird. That's kind of, there's been this medical revolution in COVID, and vaccines have been incredible. Don't get me wrong. Of the pandemic that's come out, vaccines are number 1 to 10 on the list of impact interventions globally. But the advances in medical treatments for COVID-19, particularly early COVID-19, are really incredible. And, I tell people, if we had these drugs and these potential options back in March and April of 2020, we would be rolling them out by the dozens. There'd be health systems set up for it. But it just seems to be almost a whimper these days that, we have these options, but they're not being used. So monoclonal antibodies. So monoclonal antibodies are antibodies, so the proteins that are normally used in our blood to fight COVID-19 by sticking to the virus, by preventing it from getting into the cells. A number of companies have kind of looked at which are the highest and most robust binding antibodies and basically synthesize them up in the lab. So there's a number of products on the market. They've been available for a while, although the last 2 iterations have just come to the Canadian market relatively recently. And this isn't a novel concept in infectious diseases, right? We have monoclonal antibodies to RSV that we give little kids who are premature that are going into RSV season to prevent them from getting RSV. We use passive antibody therapy for things like prevention of varicella zoster or chickenpox in pregnant women, rabies in people that are bit by rabid animals. So that, they're well proven therapies to really just augment the immune response and clear out the virus as fast as possible.